Welcome to Protector of the Pet. I'm your host, Alan Braslow, and I have with me today Joshua Portner, who is veterinarian with NorthStar Vets. They're in Maple Shade, New Jersey. I happen to be a big fan of NorthStar. They've treated a number of my dogs and cats successfully. I think they're one of the best around. And with Joshua is Phil Barnes, who's the marketing director for NorthStar. What we'd like to do is start, I guess I can share with you, I am a very big fan of these folks. They are there when you need them 24 hours a day, and some of the easiest people to work with and some of the kindest veterinarians. My own general practice veterinarian, if I have a problem, says go to NorthStar. Joshua, tell us a little bit about yourself, how you got into this, and
how I got into
your
it.
passion.
It starts when you're a kid. I think I had classmates in veterinary school that some didn't know what they wanted to do. I knew pretty early on. My start was way back when I was 15, and my mother said, if you're really interested, go volunteer. So I went and I volunteered, and sure enough, they lost a technician. So 2 months into my volunteering, they're like, "Do you want to get paid for it?" Oh, okay. So got trained up as a technician and then went off to college. I worked 3 jobs in college, one at a day practice and one at an overnight emergency practice out in Buffalo at Canisius. So did my 4 years of college there, and fell in love with emergency medicine on the spot. So, and just kind of snowballed from there. So when I finished at Canisius, I went off to Tufts University and graduated in 2004 from there, and just stuck straight with the emergency path straight on through. So for veterinarians, as soon as we graduate, we are full-fledged doctors. So a veterinarian can get out and they can practice, instantly. But for many of us, we chose to do an internship, which is really a year of no pay, struggling to pay bills on top of your school loans. But you make it work because you want to do it, and you get a year of very intense training, both medicine and surgery, just kind of a general internship. And then some of us, like myself and some of the other specialists at NorthStar, we choose to do another 3 years of intensive training and no pay. And so after 12 long years of schooling, I became boarded in emergency and critical care. And I was back in 2008, and that's when I started with NorthStar. And have moved on and up the ranks through then.
So you've been with NorthStar since, actually you could say, the second beginning of your career after you went through the 12 years.
Pretty much.
And now you are the medical director at Maple Shade.
Yes, sir.
Which many of us in South Jersey are glad to see you down here.
I'm glad to be down here. It's gorgeous down here, and it's a whole new experience. It's every place has its own character and its own experience, and love being down here.
Tell us a little bit about the facility in Maple Shade and the different, because I've been there unfortunately for the wrong reasons, but
sure.
What's there? I have my dog or a cat, I have an issue, my vet says I can't handle it.
Sure. That's exactly what we're there for. So it's funny, the facility, a lot of us that were there in the beginning, so NorthStar started as a smaller practice. Dr. Stovey started as a mobile surgeon and then put his first hospital together back in Clarksburg, and then built the main hospital in Robbinsville several years later. And the first hospital was small, only a few thousand square feet, as opposed to the 30-some-odd thousand square feet of the main hospital now. The new hospital, we're back down, the satellite clinic here in Maple Shade, we're back down to about 4,000 square feet. So it kind of, for a lot of us, say it's coming home. It feels like the old clinic because we're all together in one big team. But we're there in support of the main hospital and have pretty much everything that we need for all of the urgent things. And that's where if people call us, if there's something that we're going to expect them to need in the main hospital, we'll offer them to go straight up there. Or we can start it in Maple Shade, and that's where we've utilized the ambulance service from one of our local practitioners. And they are very helpful for the critical things that owners can't transport to the main hospital themselves if they're going to be too critical. But most of the main stuff that you'll see on a day-to-day basis, we're there for that. And then we also have a whole host of specialists that are down with us, and we're expanding our appointment days continually, as we're getting more and more specialists on board. We have a couple new specialists coming on during the summer, and so we'll be able to get more and more specialist days on top of the emergency that we're doing down in Maple Shade.
Can you give me an idea as to the different specialties that you have, and also you do treat beyond just dogs and cats, if I remember
Sure.
correctly?
Yeah. And so Specialists in the main hospital range for pretty much everything. In the main hospital in Robbinsville, we have everything from internal medicine and rehabilitation, all the way up to even theriogenology, which very few people have, which is reproductive specialty.
Wow.
And so we're getting as much and as quickly as we can down in Maple Shade for specialists, but we currently have appointments for surgery, internal medicine, ophthalmology, cardiology, and radiology as well. And then I'm there as an emergency critical care specialist that I work with my emergency doctors as well for the 24/7 emergency stuff.
And Robbinsville really isn't that far, because I know my wife
Nope.
has made the drive, and if you're driving from Cherry Hill and you go past Maple Shade, and in another 20 minutes you're in Robbinsville.
Yeah,
and
it's
right off the
about
highway.
35 minutes door to door.
Is that what it
And
is?
it's,
Okay.
34 depending on the traffic.
Right.
And so, but it's great because the two units are pretty cohesive, and we're there, in support of the main hospital. So sometimes we have a few clients that we're seeing in Robbinsville for major surgery, but they live closer to here, and they come back and see our specialists on their rechecks and
Gotcha.
things. And that was kind of the original philosophy, is that it was to be there for supporting the main hospital and being able to be there for rechecks and for primary consults as well.
Now, I know, again, in addition to dogs and cats, what other types of animals might you treat?
Pretty much, we see anything dog, cat, and smaller. And
Okay, so it's not large animals.
No.
A horse is not going to come in.
Pretty much. Our ophthalmologist will sometimes go out on some horse calls, and
Wow.
so we will do, or our ophthalmology service will do a couple horses here and there. But for the most part, it's all the smaller guys that we see, but we see a lot of the little pocket pets, the hamsters and the guinea pigs and chinchillas and rabbits and all those guys. We'll see birds and snakes and turtles and all of those guys.
Wow.
We don't have as much equipment for some of the more intense things with the exotic species, like the birds and the reptiles and such, and small mammals. But we certainly see a lot of them at the start, and if it needs to be more intensive care, that's where we can send you up to the main hospital to see one of our exotic specialists up there. If it's something that's going to be, here you go, we can treat this right now, we go ahead and do that for you.
Now, background to the other doctors as well, one of the things I found when we've gone in is everyone seems to have experience.
Mhm.
It's not like I'm walking in and someone's going to be, well, I've never seen this before, and I know I read it in a book, so let me experiment. Tell me about the background of the
Sure.
physicians, the veterinarians you have. I think of them as physicians, veterinarians, and how many.
So Phil can probably tell me how many doctors we have better than I can.
We've got more than 40 doctors on staff now at NorthStar Vets, and that helps
Wow.
keep both locations running 24/7. And that they're all in different specialties. But NorthStar Vets, if you come to NorthStar Vets, you're going to see an experienced doctor, most likely a board-certified doctor in their specialty, and that's by design. That ensures that when people come in with their pets, that they're going to get the highest level of care that we can offer them.
And then for the non-specialties, when you're in for emergency, we're picky, I guess is what it comes down to. So all of our emergency doctors have at least several years of experience in emergency medicine or have gone through a rigorous internship program. So as I said, when I graduated from school, I could have become a doctor, but I actually went through an internship program, graduated from that. So it's basically required to even think about coming on board with us to have gone through some pretty intensive training and experience before we bring them onto the team.
We mentioned a little bit about general practicing veterinarians, and my experience has been that you folks do not have any difficulty in interacting with the family vet, let's say. What's your feelings about that and the importance of being able to relate back and forth to not only the recommending vet, but if I came directly, making a call to the vet and saying, here's what we're doing, and bringing them and getting them involved?
It's our primary goal. Our goal at NorthStar is to work directly with your veterinarian, because just because we are a specialty clinic and an emergency practice doesn't mean that your practitioner isn't part of the family. Just as much as I go to my doctor, and if I go to a specialist, I want all those records in my doctor's hands, because they're coordinating the long term, the entire life of me. We want the same for your pet. And so standard procedure for us is every record, every piece of blood work that we get, every piece of information that we get, we forward on. Our goal is to work as a team with the local referring community. So our referring veterinarians and our family veterinarians that are in the area, we want to be part of their team.
And we don't do any general medicine at NorthStar Vets. So we can work more closely as partners with your family veterinarian, and that's it really creates a great dynamic for getting the best care for the pet. And lost my train of thought.
Well, I do that all the
About
time.
life.
I think we're about ready to break for a commercial. Does that sound about right? And then we'll come back and I have some additional questions for you. And we'll be right back after this short message.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
You can't predict what a pet will bring to your life, but with a plan in front of you and veterinary pet insurance behind you, you're ready for whatever comes your way. With VPI, you're ready for anything.
Ready for anything.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facial, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents. Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
Welcome back to Pet Patrol, Protector of the Pack. I'm Alan Braslow, your host. And again, I have with me Dr. Joshua Portner from NorthStar and Phil Barnes from NorthStar. When we took a break, we were starting to talk about the relationship that you folks have with the local veterinarians. And maybe, Phil, you could expand on that a little bit.
Right. So, as I mentioned, we don't do general medicine at NorthStar Vets. It's strictly specialty and emergency. And so, because of that, we're able to better partner with the family veterinarian so that when your family veterinarian decides that you need to see a specialist, like an ophthalmologist or a surgeon, they'll send you to us. We can take care of the pet, and we keep your family veterinarian in the loop. So they get records right away, so they know that the pet was there and seen what happened, and then your family veterinarian can continue the care.
Awesome. One of the things I've noticed too is I think of you folks because emergency and critical care, and unlike when something really happens, I go to that critical care location and for myself. But you're beyond that. You're the hospital. You're the critical care. You're the whole enchilada, for lack of a better term. You're everything there.
It's different. It's NorthStar Vets is not your family veterinarian practice. It's a veterinary hospital. The Robbinsville location is 33,000 square feet. It operates 24/7. So when it's 2 a.m. and something goes wrong with your pet, or if it's a holiday, we're there. And no matter what the need is, we've got a specialist to cover that. So it's definitely a full-on veterinary hospital like you would see in a major city or something like that.
And we do get a lot of day-to-day stuff as well that just, your veterinarian's booked in. I get a lot of phone calls from veterinarians just saying, hey, my client has a puppy with an ear infection. You guys have time to see it, and we always do. And that even helps because I speak to a lot of veterinarians before you even get there, and they'll be great about faxing their records to us so we can, again, continue to work with them, and we'll send our records right back to them. So I spend a lot of my day talking about, oh, hey, here's some advice, or do you need to send it over? We're here. We can do this or that for you if you just need an ultrasound. Those are the types of things that we do to work with them to really make it a cohesive unit, which is a step above even what the human hospitals do because they get everything after the fact, and we work with your veterinarian in real time.
It's interesting. We had one of our dogs needed an ultrasound, and our veterinarian Lisa sent us to you because she felt you could do a better job, and she's highly qualified. She said, I want you to go. They'll do a better job and a better read. Again, it gets because they're a specialist.
Exactly.
And
Yeah.
and then the report went back to Lisa, and I felt so comfortable because I was questioned. The questionnaire that we went through, no one assumed anything, which was very, very refreshing. It wasn't like, okay, we're here to do an ultrasound, get it done. Literally went through the history, and they confirmed everything. The staff was incredible. Question for you: what is the hardest part in your mind about being an emergency veterinarian, and how does it impact you in other ways? We were talking about that earlier.
Yeah, the funniest thing is you'd think the medicine's the hardest part. We spend all this time going through school and classes and everything, and the hardest parts about medicine you're never prepared for in school. It's really more the connections that you make. I probably spend a fair bit of my day counseling more than I am doing medicine, because especially in emergency medicine, we're seeing everything shortened into a timetable that's now. It's all now, and it's quick, and it's fast, and so you can develop a very emotional and a very intense situation in a short period of time. I get countless numbers of times that people come in and say, well, my Golden's getting older, he was just slowing down, I thought he was just, got a little arthritis, and sure enough, we do, good exam as we do, and we find suddenly, oh my goodness, this is actually a life-threatening condition. And so you can go from thinking that your dog was just getting a little older, needed some pain medication, to we're talking about emergency surgery. And so that kind of stuff is tough, because you're trying to help people through that and help them to understand without any medical knowledge sometimes, and through the entire intensity of the situation. And sometimes it's as basic as an ear infection, but it can be as intense as life-threatening, or even harder, getting into the euthanasia stuff. We see things that are true quality of life issues, and those can range from things that are life-threatening conditions to just old age conditions that it's kind of time, but if your veterinarian's not there, it's 2 o'clock in the morning on a Sunday night, really we become your primary veterinarian for that 20 minutes, half hour, whatever you need to get through, and it takes a toll. You have to, you're involved. We do this because we love pets, and we do this because we are there to help pets, and you have to get to a point that you're still with the family and helping the family through it, and know that you're helping, but also keeping enough of a distance that you don't drive yourself crazy.
Now, how does that impact you on being able to have your own pets? Because your hours must be 24/7.
So certainly, thankfully, we have a lot of doctors, and so we have shifts, and we're able to go home, and so some people can do it. Personally, I don't have pets because of the time constraints involved with the job, especially being medical director. I have hours on the floor, and I have hours that are off the floor, and I have hours that I'm doing work at home, and I'm doing work in the Wi-Fi at the restaurant while I'm eating dinner. So that kind of time commitment is something that I've decided is really not fair for me to own a pet that I can't get home to in time. And so it's helpful for me because I get the exposure and I get the experience with my patients and my clients, and have developed some very interesting relationships over the years.
It's a good point you said. I wish more people understood that if you do not have the time to have a pet, then do yourself and the pet a favor and don't have one. I've seen too many adoptions over the years where they take a pet in and then they think they ignore it.
Right.
And it's not because they're bad people, but they just don't have the time, and they never should have gotten one in the first place.
Yep.
Go volunteer and walk a dog somewhere at a shelter or whatever, but do what you can do.
And we do. We see problems in the clinic. We see health problems related to that.
Really?
Of people, not having the time, and not that they have ill intents. It's just the matter of, you made an example earlier of, puppies need to go out frequently. Puppies are a lot of work.
Mm-hmm.
And so we see even obstructions from foreign material because puppies are getting bored. If they're home too long by themselves, they get bored, they chew things, and sometimes that's why they swallowed something that then I have to go take out surgically. And so it's a grander scheme, if you will. It's a grander plan, and that kind of time commitment has to be there. You have to be ready for it. You have to be in a place to be able to do it.
Thinking over the years, because we all say someday I'm going to write a book, you know,
Yeah.
and this one I'm going to write it about. And the chapter comes up the most interesting or unique cases that I've seen. Do you have any that stick in your mind?
You know, there's always some, and I think a lot of them come down to really the most intense of cases. And we had shortly after I started at NorthStar, I remember one dog, Teddy. He was a middle-aged Airedale, and he swallowed a corn cob. And he went to surgery, and that dog had every complication known to man. You know, it had nothing to do with what we were doing or how we were doing it. It was just a matter of him. And so he ended up with an infection that was resistant to bacteria, so he ended up going to a second surgery, and then his adrenal glands weren't keeping up with the hormones that he needed to recover, and so he ended up having to manage that for a while. And I think Teddy spent, I want to say, probably close to 2 weeks with us in the hospital.
Wow.
And so developed lifelong relationships with those folks, even though, you know, me as emergency and critical care, I don't have very many, if any, long-term patients. I've only had maybe a handful of long-term patients. But then Teddy continued to come in to deal with his endocrine problem and his adrenal glands with our internal medicine specialist. So I got to see them for a long period of time afterwards. And that was one of those that you really, it sticks in your mind because you saw him in his worst states and at the brink of death, and then get to see him come back and live, you know, another many years and do very well with the owners. We had another little puppy that was jumped on by a housemate. It was a tiny little Yorkie, I think maybe a 3-pound dog, and was playing, and the other dog was much larger, roughhoused, and actually jumped on the puppy's head, and that puppy ended up with many, many skull fractures. And we ended up having that dog in the hospital for a long period of time. I want to say probably about 10 days or so, and watching her go from a dog that many people didn't think was going to survive. And
Wow.
you know, we worked really hard and we gave that puppy a chance. And what was really neat is to see this puppy come back and go from a dog that could not see, could not walk, could not function as a dog. You know, we were assisting feeding and everything else, to a dog that was walking with only some very minor neurologic deficits after such an intense, literally brink of death moment for them.
Wow. We're going to take a short break, and then we'll be right back.
You can't predict what a pet will bring to your life, but with a plan in front of you and veterinary pet insurance behind you, you're ready for whatever comes your way. With VPI, you're ready for anything.
Ready for anything.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
Welcome back to Pet Patrol, Protector of the Pack. I'm Alan Braslow, your host. And again with me is Joshua Portner, veterinarian with NorthStar Vets in Maple Shade. He's the medical director. And Phil Barnes, who's the marketing director. Had a question I was thinking about during the break. In our house, our pets tend to get themselves sick, usually when the veterinarian's normal hours don't exist anymore?
Murphy's Law.
Right. And I have two options. One is I text Dr. Lisa, because she and I have this open relationship where she constantly gets back to me, and she'll tell me what to do. Or if I'm not there, my wife will say, I'm on my way to NorthStar, meet me there. What are the guidelines that you should be looking for? Because unlike our kids who can tell us, we don't always know what to look for in our pets and when we should be calling you. And what happens if we call you and not just show up? You know, what do you recommend?
Well, first thing we always recommend is if you're worried, come see us, because sometimes peace of mind is worth the trip in.
Okay.
And so if you're ever just that concerned that you're not going to sleep at night, just come on in. You know, certainly there's some basic things that you can look for that is the same stuff that you look for almost in your own children. You know, if knowing normal is good, you know, knowing what's normal for your pet, and these are things that you can look up online, and there's even some training seminars that Phil can talk about a little bit coming up that talk about some of these things, but knowing what your pet's gum color looks like, and some people even are adept at taking their own pet's temperature, so if they're feeling a little off, we can take their temperature rectally and know that normal for dogs and cats is between 100 and 101.5, so if you're getting up over 103, 103.5, sometimes that's a good indicator to come in. You know, you're looking for all the basics of, okay, they started vomiting. If we vomit once or twice, you know, your puppy gets into something, might irritate the stomach, you vomit once or twice, you know, that's usually not that big of a deal. But if he continues to vomit several times, or one of the other big things that we look for, especially in big dogs, if they're vomiting and not producing anything, that can be pretty life-threatening if they have a GDV develop.
GDV being?
GDV is a term in big dogs. It's also known as bloat, where the stomach can twist on itself, and that can get life-threatening within even a couple of hours. And so that's one of those, the number one sign for that is retching without any production whatsoever, or sometimes just a little bit of foam.
Will that ever happen with a small dog? I know big dogs, but...
I have actually seen it in a couple small dogs. I've seen it as small as a Bichon and a Beagle.
Wow.
And so I haven't seen it personally, but I have had colleagues that have seen even cats that have had that condition happen. It's a very rare occurrence. The other major thing to watch for, especially in young male cats, is urinations. You know, if your pet is straining to pee and can't get anything out, that can also be life-threatening very, very quickly. And if you're ever unsure, we encourage you to call your veterinarian, and if they're not available, call us. You know, we can talk you through a lot of stuff on the phone. We can't necessarily diagnose everything over the phone, but we can give you a couple quick ideas, you know, things to look for, things to see. And again, if you're concerned, just bring them in.
Great. Another question I had for you, pet insurance. What are your thoughts on pet insurance? Because there's got to be good, bad, and everything. And is there any that you find are easier to work with and less challenging when you're treating a dog or a cat than others?
Sure. I think pet insurance is becoming more and more popular these days, and it's becoming more and more useful. As companies are now starting to compete with each other, they want to see more clients coming in, because how insurance works is the more population you have in the program, the easier it is for them to be able to support the ones that do get sick. And just like in human medicine, every insurance policy is a little bit different. So it's one of those situations that the downside is always buyer beware. You know, read your policies, know what you're getting into, look into different companies and see what they're there for. But as you can imagine, veterinary medicine itself is becoming more and more expensive because our overhead's becoming more expensive. You know, you figure we have how many doctors to pay, and you figure you have 3 or 4 staff people that are there in support of that doctor every day, and on a 24-hour basis you have to keep the heat on and the lights on, and you know, a radiology machine that might be a $250,000 piece of equipment, and all the lab machinery that we have and the ultrasound machinery. You know, the technology's there, and we're using all the same technology that's in human medicine, especially at NorthStar, where we have everything on the cutting edge. You know, you got to be able to pay for it so you can keep the doors open for people to come in, and that's where, therefore, the costs have to be high. Insurance can help with that, and I have a number of clients that have had insurance policies, and it's made all the difference in the world. We had a patient several years ago that had a toxicity in her bone marrow, and her bone marrow shut down for a little while, and she was in the hospital for nearly 21 days,
Wow.
and to the tune of tens of thousands of dollars. And the insurance policy paid $20,000 of their bill.
Wow.
And otherwise, she probably would not have been able to survive.
Interesting. Question for you, Phil. I've been to some of the seminars that your folks have done. They did one that fascinated me with one of our veterinarians, and it was on pediatric spay-neuter, which made me understand better the impact that you can have and why not to.
Yeah.
What type of seminars are you running? What's coming up? Give me a couple of minutes on that, and then if you can wrap into it, how can people contact you? What's the best way? Because I don't want them to miss out on that.
Yeah. Well, we believe that educated pet owners make better decisions for their pets. And so we put out a couple of times a year, we do pet first aid classes for pet owners, so they can come and they can learn from our ER doctors some basic pet first aid. We've done lectures on winter safety and summer safety concerns, and some other topics for breeder clubs and things like that. So we're constantly putting out a lot of client education. We just I think you just spoke last weekend at a
Yep.
pet event, and our veterinary dentist gave a talk about the importance of taking care of your pet's teeth. We're also working on a booklet that we can hand out as an electronic version and a hard copy version that pet owners can have. It's a nice little reference book for the different kinds of things that can happen to pets and what to do. And so we'll have that for pet owners. And so there's just a lot of stuff that you can find at our website, all these different educational opportunities to stay informed and to learn more about how to take care of your pets.
So an educated owner, it's like an educated consumer. Cy Sims used to say.
Yep.
It's my
Yep.
best customer is an educated consumer.
Yeah.
Interesting. How do people reach you? The locations,
Yeah.
the hours, and
So
what's the best?
we have two locations. The main hospital is in Robbinsville, New Jersey. It's at the intersection of the New Jersey Turnpike and Route 195. It's there 24/7. In Maple Shade, we're there at the intersection of routes 38 and 73. There's the Lowe's Shopping Center there. The phone number to catch either location is 609-259-8300. And of course, you can visit us online at www.northstarvets.com.
I want to thank both of you for coming in. This was a privilege for me to host this session. What do they say? It's like the hair club for men. I don't really have it, but I'm a customer. I use my own product. You folks have been fantastic every time we've needed you, and I don't think there's any other place I would go in case of an emergency. If I can't reach Lisa, I'm calling you folks.
Right.
So again, Josh, Phil, thank you very much.
Thanks so much
Thanks for having us, Alan.
Yeah, it's a pleasure.